Next question is, I am currently healing endometrial cancer. I have IBS-C. I started following a completely organic vegan diet and juicing for the past 8 months. Unfortunately, after months of a very clean diet, detoxing and juicing, I developed a pretty severe candida overgrowth. I've got SIBO, which is small intestinal bacterial overgrowth, and even parasites. I have been taking lots of supplements and probiotics, etc., to heal my gut, and have done antiparasitics as well. What do you use for people to heal their gut and microbiome? I feel like juicing is such a huge part of healing, but anytime I drink juice, carrot, green, or any, I feel sick. I seem to be a weird case according to the doctors and others, and that typical dietary changes make me worse. Thank you.
Let's talk about intuition, because I think that that's really important. We need to listen to our bodies. Our bodies are extremely intelligent, and we spend so much time ignoring the signals, right? So we need to dial into that intuition, trust that intuition, listen to the signals that your body's giving to you. There was a lot in that question, and it was long, so I don't remember all of it, but there was a lot in that question about juicing. So I do want to address that because it ties into what we were just talking about with metabolic health. So in trying to achieve metabolic health, what we're trying to do is decrease blood sugar, decrease insulin, which will then in turn decrease insulin-like growth factor and growth hormone, right? Sugar, like everyone understands that table sugar is sugar. Most people understand that honey is sugar and syrup is sugar. And I get asked all the time, well, isn't fruit okay? And yes, fruit is okay when we're eating it as fruit, because when we're eating it as whole fruit, it is bound to fiber, and fiber has so many benefits. This is why people who go on whole food, plant-based diets do so well, because they are so rich in fiber. And fiber, amongst other things, is a great binder of toxins. It also feeds our microbiome, that ecosystem of organisms that lives in and on us. And it also prevents us from accessing that sugar. So when sugar, like fruit, fructose, is consumed as a whole fruit, it is bound to fiber, and we can't grab it, absorb it. And so it really doesn't raise our blood sugar. When you juice, you remove all the fiber. So even if you are getting the benefit of the nutrients, not all of the nutrients, because you're getting you're not consuming a lot when you juice, but you are getting some of the nutrients. But guess what you're also getting? Pure sugar. Pure sugar, unbound to fiber. You are literally uncoupling it. And for many people, you might as well be eating sugar. It's having the same effect. It's spiking your blood sugar. And I don't think there's that much benefit to doing it. Now, people always counteract me by saying, well, I can't eat a whole bag of celery, a whole bunch of celery, so that's why I juice. Okay, so you can't eat a whole bunch of celery. Eat 3 celery sticks. Get the fiber. You're still going to get the nutrient, right? But so what I want people to come away with is, when we do something to change the state of that food, we are now consuming processed food. It may not be ultra processed food, right? It may still be unchanged to some extent, but whenever we process food, we take away its characteristics. So when you juice, you are processing that food. You are making those sugars directly available. and you are changing the nutrient component and you're depriving yourself of the fiber. So I'm not a fan of juicing. As far as the rest of that question goes, I think it's very hard to solve these things on your own. I just do. When I was sick, I was a traditional medical doctor, and I spent 3 years learning about functional medicine, training in functional medicine, and experimenting on myself, right? So it took me quite some time to heal because I was in a bunch of trial and error and trying to figure it out on my own, which incidentally, if I got sick again tomorrow, I would not try to figure it out on my own, only because people, caregivers or providers are the worst doctors for themselves. So, like if I had to do it all over again, I would definitely get help because I'm the last person on my list. And I think for the lay person to try to figure this out is near impossible. I mean, you may do it, but it's going to take you years and years and years, and it's going to be really costly in terms of your health. So I do recommend that someone who is suffering with gut problems, with gut health, since the gut is so central to our health, I do recommend that they work with a provider who is very familiar with gut function and can help them to heal.
Yes, I think that that's true too, because if our guts are not healed and they're not sealed, then we're going to get into this and it's going to continue. Right.
Yeah.
And so, I love the fact though, that, if she does have the SIBO and she does have those, she's listening to her body and, can stop that. So it's one of those things too, where sometimes we feel like, wait, we're supposed to be doing this. This is supposed to be good for us, but it's not, so there's that.
Yeah.
So a question, I'm sorry, were you going to say something?
No, this is just a great example of the fact that we are all bio-individual. So what works for me may not work for you, and what works for you may not work for this woman, right? So we can't make any kind of this is really good for you statements because carrot juice clearly is not good for her, right? So just because the food is seemingly good doesn't mean it's good for you.
Correct. And I think that's one of the things, like for food sensitivities, especially, people will tell you, oh, this is supposed to be good for you. But if it's not reacting to you, it's not, it's terrible. It's causing an inflammatory response. Then, your histamines, go crazy and all kinds of other things like you had talked about.